Good evening, everybody, and welcome to June's meeting of the Customer and Corporate Services and Scrutiny Management Committee. As with last month's meeting, because of the government's decision to insist on the return of face-to-face public meetings while social distancing rules remain in place, we are again in the unusual situation of having to hold an informal remote meeting this evening. So just so that everybody's clear about the context in which this meeting is held, I'm just going to read the paragraph that's at the start of the public reports pack. So this is not a formal meeting of this Scrutiny Committee. The Council is operating its scrutiny and decision-making meetings in accordance with statutory requirements relating to holding COVID-safe meetings between the 7th of May and the 21st of June 2021. As non-decision-making bodies, members of this Council's Scrutiny Committees will continue to hold public informal sessions remotely for the purpose of commenting only on the business set out in the agenda below. Members of the public may register to speak in the usual way set out below. Okay, so with that noted, we'll move forward. There's been some changes to the committee membership since the last time that we met. So I'd like to thank Councillors Hunter, Mason and Kilbane for their contribution to this committee over the past year and 2 years respectively. And I'd like to welcome Councillors Hook, Baker and Norman to this committee's membership. Also noting that Councillor Norman is the new chair of the Economy in Place Scrutiny Committee. So this evening's meeting, as usual, is being webcast. So just to remind you, it will be there for posterity. So I hope you'll all behave yourselves. And just so that we know how the meeting works, for those new members of the committee, we operate using Zoom to ask for an interjection or a question. But if you want to make a supplementary point, if you just raise a physical hand, I'll keep an eye out and I'll try to bring you in at an appropriate point in the discussion. On the call with us this evening, we have Janie Berry, who is the Council's Monitoring Officer and the Director of Governance. And we're also joined by Rachel Antonelli, who is the Senior Solicitor at the Council and Interim Deputy Monitoring Officer as well. So in terms of apologies for this evening's meeting, I've received one set of apologies from Councillor Baker. And also just note that Dawn Steele, who is the Head of Democratic Services, is not currently with us this evening. And so I would hope that committee members will want to send her our best wishes as she is usually in attendance at this meeting. So on to the main items of business. Item 1 is declarations of interest. Do I have anybody wishing to make any declaration? No, not seeing anybody. So on to agenda item 2, which is the minutes of the meetings. We've got one set to agree this evening, which are the minutes from well, it says the April meeting, but I think, oh no, sorry, I apologize, I'm reading the resolves. We resolved to approve the April minutes. We're on to the May's minutes. We are where we are. I just had one correction that I wanted to propose, which was on page 3 at the bottom on the resolve. When we were discussing monitoring and tracking of approved council motions, the resolve reads that CSMC would like to recommend to executive a regular update provided for tracking council motions. And I think what we actually resolved was that myself as chair and the vice chair, Councillor Fenton, would go away and have a discussion with the head of democratic services, consult with the chair and vice chair of audit and governance, and would come back with a set of options or recommendations for this committee to then endorse once we're formally constituted, and depending on what the right way forward is, either make them as a recommendation to executive or take them as a new way of the committee monitoring those motions, depending on whether we need executive endorsement or not. So I've tried to summarize that in a paragraph, which I'll just propose that we amend the minutes, and if everybody's happy, I'll email it over to Dem Services just to add. So the resolve would read, committee resolves that the chair and vice chair, in consultation with the head of democratic services and chair and vice chair of A&G, would agree a workable set of measures for the improved tracking and monitoring of adopted council motions, and that proposals would be brought to a future formally constituted meeting of this committee such that they may be adopted or endorsed as a formal recommendation to executive as appropriate. If everybody's happy with that, if I could just see a quick show of hands. That's great. So I'll email that wording to the democracy officer so that we can just update those minutes, and then I'll get them signed unless anybody has any other comments they wanted to make. Not seeing any, so I'll take that as that we're happy with them as they are. So on to agenda item 3, which is public participation. We haven't had any registrations to speak this evening, so we can get straight on to agenda item 4, which is the public health update on COVID-19. We're joined this evening by Fiona Phillips, who, if you'd like to come and join us at the virtual table. Good evening, Fiona. Fiona is the Assistant Director of Public Health and has a presentation for us, which was circulated to members in advance, but if you'd like to take us through that presentation now, I'll then invite members to ask some questions.
Thank you, Chair. Okay, so what I'm going to share is just a bit of an update in terms of data and where we are in City of York Council at the moment. As you've probably already picked up, we have seen an increase in cases in York. So currently our rate per 100,000 stands at 46.1. So over the course of the week, in the last week, that was 97 cases. So that is an increase, and that is something that is being seen really across the board nationally, really. And when we look at our unvalidated rate, that's currently at 61.7. So what that means is we're going to see that increase continuing at, at least for the next week or so. What you can see there as well is that where we sit in comparison with other areas in the Yorkshire and Humber region. So I think when Sharon presented to you at your last meeting, we had the lowest rate in the region. So we're now kind of sitting about midway in comparison with other areas. So just to then look at what we're seeing in terms of the rate in the 60 plus population. So the positive news is that we haven't seen much of a rise in that age group, and that still is low. So in the latest period, we'd only had 3 cases in that age group, and that is a lower level than what we're seeing nationally and in the Yorkshire and Humber region. So that is one positive. The other thing just showing you here on the slides is our positivity rate across all of our sort of testing strands. So we have seen the positivity rate in the Pillar 2 PCR testing. So that's where you go either to the drive-through or the walk-in PCR testing site. We have seen an increase in that up to 3.41%. And as you can see from the graph there, that has also happened within the region and in England as a whole. Now we often talk about wanting to keep that positivity rate below 5%. So we're not up to the 5% yet, but obviously, we are creeping towards that. So if we do go above the 5% and we start to see that continuing to rise in areas across York, what we generally start to do is talk about, what increased testing might we need. So if you remember back to earlier this year where we had mobile testing units in various areas of the city where we had increased rates. So we're not at that stage yet, but it's obviously something that we are monitoring. The positivity rates in some of the other testing strands, like the symptom-free testing and the Pillar 1, which is the hospital testing, have stayed low. So just want to talk a little bit about where we're seeing cases. So this is a breakdown by age group. So looking at the week up to the 6th of June and then comparing that to what we've seen in the most recent data up to the 13th of June. So I want to draw your attention in particular to the 10 to 19 and the 20 to 29 age brackets. So you can see in the 10 to 19, we have had an increase there, and similarly with the 20 to 29, and that is where we're seeing most cases, and that kind of fits with those are the age groups who are not vaccinated yet. I do also want to just sort of have a look at the 30 to 50 age group as well. So whilst overall numbers are lower in that age group, we have seen some increases as well. And obviously, you know, the older you get, you know, you're more likely to have some underlying conditions as well. And this is an age group where people will have at least been offered one vaccine, if not being nearly on to the second vaccine yet. But what we are seeing is that we are getting some cases in people who've had one vaccine but not had the second dose as yet. What we unfortunately don't get is linked information to say whether people who have tested positive have had one or two doses of the vaccine. So we can't see that and analyse that as at a local level. But what we do understand from some of the national studies that are being done is that generally people who've had two doses of the vaccine, you do get some positives, but it's much more uncommon. But we are seeing cases in people who've had one dose of the vaccine, and that's particularly as well with the Delta variant that is becoming the more dominant strain of COVID across England now. So it's really a lot of the work we're doing now is to stress the importance of, if you've had your first dose, you need to make sure you book in and have that second dose done. The other thing, obviously, which gives us an indication as well about whether people who are getting COVID now are becoming unwell, is whether we're seeing people contacting NHS 111, reporting symptoms, and then whether that leads into hospital admissions. So we're not seeing a particular rise in people contacting NHS 111 reporting symptoms like COVID, and I'll come on to talk about hospital admissions in a little bit. So hopefully what we're seeing in York is that we are getting cases in the younger age groups, but potentially not leading to as much ill health as the position that we were in earlier this year when we had that wave. So just to go on then to talk a little bit about the variants of concern. So what we are seeing in York, as in many cases, is the Delta variant is now becoming the more dominant variant. And what we know about that variant of COVID is that it is more transmissible than the Alpha variant, which we saw being the dominant variant earlier this year. So those public health measures of, you know, distance, hand washing, face coverings just become more important really as we, you know, learn more about this variant and what it means. There is evidence to suggest that the vaccine does prevent against the Delta variant, but much more so, as I say, when you've had two doses of the vaccination rather than just the one. Yes, I said I'd talk about COVID patients in York Hospital. Now, this is data as at the 8th of June. And at that point, as you can see, at that time there were only 2 COVID patients in York Hospital, and we hadn't really seen much of an increase. I do understand from today, but I don't have it as validated data, but we have been contacted by the hospital to say that they have seen a bit of a rise over the weekend, and that figure now stands at 5. So it's still low when you think about where we were earlier in the year, but we do need to be very cautious now that we could potentially be seeing a rise. How that you know, what level that will go to, I can't say as yet, but there may be a slight upturn in hospital admissions in York. We also monitor deaths. So in the most recent period, there were no COVID deaths. We haven't had any COVID deaths of York residents since the end of April. So again, that is positive. But what we have always said previously is from when you get an increase in cases, previously it would take 1 to 2 weeks before you would see hospital admissions, which may be what we are starting to see now, but then it will take another sort of 2 to 3 weeks before you would see any deaths coming through. So this is something ourselves, and obviously, as I say, this is happening in many parts of the country, is being carefully monitored now. Just talking about particular settings. So we still have had no outbreaks in residential care settings where we know there is a good uptake of vaccines, and that has been the case since the end of February. And what I showed you in terms of the age groups who are now getting COVID. So as you can see here, up to the 13th of June, there were 16 children of school age testing positive across 9 different schools. And I think what we will start to see is those cases in the school age children going up. So that obviously has, you know, whilst we may not see illness, particularly with those children, what that is going to mean is school classes and bubbles having to send significant numbers of children home who are having to self-isolate. So it will have an impact on the schools and school communities, and then that has that ripple effect of, you know, potentially affecting parents who can go out to work because they're having to look after children. So vaccinations, so the rollout of the vaccination programme is still going well. So we've got over 70% of the 18 plus population in York have had their first dose of the vaccine, and then just over 50% who have had the second dose. So that is positive. When we look in terms of those who's had vaccination by the different categories, obviously the younger age groups, the sort of 18 to 29-year-olds, they've only fairly recently had the programme opened up to them. So those numbers are lower, and as we go up the age groups, the numbers taking it up do increase. I think we've said it before, though, that there are some inequalities within York. So we see some of our wards like Guildhall, Fishergate, where the rates of first dose are a bit lower, and we've been working with Nimbus Care looking at what we can do in terms of pop-up clinics, particularly in the city centre, to make access to those vaccines much more easy for those populations. And then also when we look at uptake by ethnic group, we're also seeing an inequality there in that some of our residents from Black and minority ethnic groups have not taken up or have not been able to access the vaccine. So again, just working with Nimbus to look at how we can do as much to make the vaccine accessible to those populations. So that's all the slides that I had to share, and I'm happy to answer any questions from members.
Thank you very much for that, Fiona. I think we're probably all, I'm not sure what the right word is, but you know, certainly watching closely what's happening with the infection rates, aren't we? And you know, just crossing fingers. I think it feels like a bit of a difficult time at the moment for where things may go. And of course, our esteemed Prime Minister is about to make an announcement, I think, in the next few minutes, which I think has been widely trailed, suggesting that things are going to stay as they are, at least for the next 4 weeks or so. I'm just going to invite committee members to just use your Zoom hand if you did want to ask a question. And I see Councillor Fenton's got his hand up, so I'll go to him straight away.
Thank you, Chair, and thank you, Fiona, for the update. Just on the slide on vaccine take up by ward, I was just sort of really interested in what you've managed to establish in terms of sort of reason potentially for reluctance in taking the vaccine, and also what your measure of ward population is. And I was sort of thinking about the wards where the percentage take up is quite low. Could there be an element of people who are resident in that ward also having a residence elsewhere? I'm thinking in terms of students, maybe people who have a home in York and a home elsewhere who may have access to vaccination at a secondary address. Is that the kind of thing that you've you've looked at in terms of trying to identify reasons why people who we consider to be resident in York haven't taken up the vaccine in York? I may be sort of barking up completely the wrong tree, but it just struck me as something that could be a possibility, and wondered if you'd kind of looked into that to try and help understand what's happening in those wards.
Yeah, no, it's a good question and some good points. So we don't have a sort of comprehensive answer for that for everybody who has or hasn't taken the vaccine. But one of the things that we have been doing is our contact tracing team have been working with two of the bigger sort of central York practices, contacting patients who haven't had the vaccine, to just have a conversation with them, ask if there's any particular reason why, anything they can do to support. So of those people that they have managed to speak to and have a conversation, overall, the biggest reason that people have given is that they've got some concerns about the vaccine. So, whether it's safe, whether it's effective. Now, in some cases, our team can, have a conversation with them and allay those fears and book them on. Other people, they want a bit more time to think about it, or they're still not convinced, and obviously people have their own opinions around that. So that's by far the biggest reason overall in that group that they've been calling. One of the other things that we have been doing as well is that our testing team have been going into the wards where we've got our youngest population, which actually also does coincide with some of those wards where vaccine uptake is lowest, to talk about the importance of symptom-free testing. And where they've engaged with people on the doorstep and people are happy to have a conversation, they also will talk to them about vaccination as well, and ask them about their views on vaccination, whether they've been offered it, when they get offered it, will they take it up, and that kind of conversation. And this is a bit more anecdotal, but what in those particular wards in the city centre, what they're finding more is, in that population, it does tend to be more about those kind of practical barriers, particularly in the younger groups who are working, they live in the city, live more in the city centre, so may not have a car. They talk more about, actually, it's the practical barriers around getting down to Askham Bar that is kind of putting them off wanting to go and have the vaccine. We have had some cases from the contact tracers doing the phone calls where, yes, people have they've rung people and they're actually abroad, and they've not been able to get back because of travel restrictions, and so they're having some issues there. But yeah, there's kind of two distinct reasons that we're getting around that. So as I say, all the work that we've been doing around trying to get out messages about the safety of the vaccine and have those conversations. But then in terms of some of the practical barriers, just working with Nimbus Care to look at what can we do in the city centre to just make that access that bit easier.
Thanks, Fiona. Just before I bring in Councillor Rowley, I've just got a sort of supplementary on that, because I'd picked up that discrepancy between the sort of, broadly speaking, city centre wards and some of the outer areas. And this was something that I think was picked up a couple of months ago initially. And my recollection is that the numbers looked quite similar then, But have you had any indication since it was first identified as a potential issue that those wards where the take-up rate is lower, are they closing the gap at all? You know, have the interventions worked so far, or have you sort of not see, you know, is it a stubborn number?
I'd love to say yes, but unfortunately I can't. So I presented that to Outbreak Management Board last week, actually, to say that the order is still the same. So the wards that were the lowest a month, 2 months ago are still the lowest. And whilst the percentage has changed a little bit, it's very small. So I think from memory, the Guildhall wall previously was something like 74 point something percent, and now it's 75 point something, so less than a percentage change. So unfortunately it is appearing that it's quite a stubborn rate.
Okay, thank you. Councillor Rowley.
Thank you, Chair. Thank you, Fiona, thorough as ever. My question really is probably to Pauline, but it is with regards to the COVID situation. If as expected, the Prime Minister does delay the final phase of lockdown, I have two questions. One is, do the discounted fees at the York Crematorium continue until such times as lockdown is finished and the social restrictions are finished? And secondly, what would happen to the businesses that are qualifying for business rate relief? A lot of businesses, including mine, have received our amended business rate letter, but I'm not sure if there's anything in place to continue that should the restrictions not be lifted as we expect it to be.
Am I okay to respond, Chair?
Yes, yeah, you're very welcome to.
Yeah, just on the funerals then, yes, the discounted fees will continue until we move into what is step 4 at whatever date we go into, and that includes the free recording of the services as well. So yes, we won't return to full fees until that point. I can't answer your question on the rate relief. We will be very much driven by communication from the government on that issue, and as with all the business grants communications that we've undertaken in the past, we will try and communicate that out as quickly as possible to all businesses in the city when we have that information.
Thanks, Pauline, and I'm sure we'll see you later on. So I'm looking just if anybody else has got any further questions. I have a couple, but I'll let anybody else jump in ahead if you've got anything that you wanted to. I'm not seeing any hands going up, so just a couple of thoughts, and hopefully these will be relatively straightforward to answer, Fiona, but have you had any indication at all, because obviously if, as expected, we're looking at a sort of a 4-week delay, and I think a lot of the logic to that is to try to get as many people vaccinated as quickly as possible. Has there been any indication of people having their second doses brought forward? Because I know, you know, when I had my first dose, it was sort of 10 or 12 weeks before you booked in your second. Is there any steer on that as to whether that might happen, or is that just in surge areas that seems to be happening?
No, it has happened in York. So people have been asked to book on to 8 weeks. So they have brought that forward to have the second dose at 8 weeks. I think one of the things we're hearing anecdotally, though, is that you have to cancel your appointment and then book on an earlier slot. And I think some people are a little bit worried of, what if I cancel my appointment and then I can't get one that I can go to at the 8 weeks? So I think some people are thinking, I might just leave it there and stick with the 12-week appointment, because I know I've got that and I can definitely go to that. But I think, what, and you may be aware that Nimbus Care have been putting on additional sort of sessions at Askham Bar as well. They've done sort of, late night shifts over weekends, etc. So we're not hearing that there's any issues with appointments. So I think my message would be, yes, if do try and bring it forward and just get that second dose as soon as possible, particularly with this Delta variant.
That's really helpful. And speaking personally, I wasn't aware that that was the case. So it may just be me, but I don't know whether comms have already gone out around that, or whether there's perhaps something that we could do to just make sure that people who have got a second dose in the diary, date in the diary, as it were, know that they potentially are eligible to bring it forward.
Yeah, I can pick that up with comms colleagues. Obviously, a lot of the comms about vaccines comes out from the CCG or Nimbus Care, but I can certainly pick that up so that we do a bit of a push around that.
Thank you. Councillor Fenton, you got your hand up.
Thank you, Chair. I think just to add to that, Fiona, if you are in discussion with Nimbus Care and others, I think you're right. I know of friends who have been on the sort of the cusp of trying to rebook, but then understanding they would have to cancel, and the advice they got seemed to be incomplete or inconsistent as to what steps they would need to take to book a new slot. So if there were some kind of simple step-by-step guide, so that that would give people the confidence to cancel and rebook, I think that would hopefully help in terms of if there is the capacity available. It would seem a shame for people not to be able to access it because of a lack of clarity around the booking process. But that would be helpful. Thank you.
Okay, thank you. That's helpful to know, and yeah, we can certainly look to that. I mean, definitely for people who had a first dose of the AstraZeneca vaccine, because that isn't being used in the under 30 population, there is definitely no sort of issue with supply or getting access to second doses of the AstraZeneca. But yeah, I think a sort of simple guide to how people can make that change and give them the confidence, we can look into that.
Thanks again, Fiona. I'm not seeing other blue hands, but I have got a couple of other questions. So by all means, if anybody thinks of any further questions they want, do feel free to jump in, or stick your hand up anyway, I'll bring you in. I'm not sure how best to phrase this, Fiona, and I don't want to discuss it in any sort of a alarming or concerning way, but I know that pre-Christmas, some of the businesses in the city centre were concerned about people travelling into York from areas of sort of higher infection, and potentially maybe putting shop workers at a slightly greater risk, or we're worried that York perhaps became we had quite a steep rise, didn't we, at one point in terms of infection rates. And obviously, it's great seeing town busy and thriving. I've been into town a couple of times in the last couple of weeks and been quite amazed at how busy it is. But I'm also kind of hearing anecdotally from people that York seems to be busier than some of the other town centres in the region and nearby. Is there a concern at all amongst public health that we may end up sort of inadvertently becoming a bit of a sort of not super spreader place, but somewhere that perhaps if there are surges in regional infection rates, that York may inadvertently cause a greater spread because of its popularity, as it were? I hope that makes sense. But
yeah, no, it does. I mean, it's a really difficult one, isn't it? Because obviously, you know, when we're looking at health and well-being, you know, we need the economy as well. It's a key part of having good health and well-being, and if people have jobs and employment. So, you know, there is a really difficult balance between having a thriving economy, but also protecting against risks from something like COVID. I mean, I think what we are seeing, and you know, other places are seeing this as well, that by far and it was the same as well before Christmas, the most common route of transmission is through household contacts. Obviously, it has to come into the household somewhere, but once it's in a household, you know, what we're seeing is that pretty much others in the household come down with it as well. So that kind of household transmission is still key. And you know, obviously, with a virus, the more social contact you have, the more likely you are to spread the virus. So you know, if there are you know, people meeting in York, and you know, yes, that social contact can spread it. But I think, again, what we see is if you're in a business where it's quite a controlled environment, so you know, there's good cleaning regimes, you know, you can't do things like stand around the bar in a pub because it's, you know, it's very ordered, that actually probably the risk from that is less than when people get together and meet in their own homes, where, you know, after a couple of drinks, you maybe forget about those measures, and you're not doing that kind of regular cleaning and that kind of thing. So that's probably where we see the most risk from those kind of unregulated social activities. But you know, yeah, inevitably that social contact is what drives an increase in infection. And we're at that point now where we are just waiting to see, is it going to be an increase in cases, but people not becoming that unwell, and it becomes something that, you know, we're living with like a flu, or are we going to see, you know, increase in hospital admissions and more serious illness as well?
thank you. That's helpful. One final question from me, and it was just harking back to, you mentioned about school age children and the potential for infections there, and obviously, you know, that population not currently being vaccinated, and so, you know, being a potential significant area of things spreading. And I just wondered, because obviously we'll all be very concerned about, you know, children in bubbles having to be sent home, and you know, all of the impacts of that. Could you just remind people though what the rules are for where you you know, in a situation where if you know, have a child that is asked to isolate? Because I know, again, speaking as a parent, some of the other parents that I speak to aren't always clear whether the whole household has to isolate if their child's sent home, how long they have to isolate, whether they can take a test and it be negative and then go back into school. So if you could just, I think it's probably worth just reiterating what the guidance is around that.
Yeah, so if your child is told that someone in their school bubble has tested positive and they need to isolate as a result of that, then that is just the child who has to isolate. It's not the rest of the household, and they have to isolate for 10 days from the point of the last contact with that person. There is, we do say now that if you've been told you've been a contact of a case, you can go and have a PCR test. So not the lateral flow test, but if you feel you want to, you can go and have a PCR test to check your infection status. But even if that test came back as negative, you would still have to complete your isolation period. There are some national pilots going on that Oxford University are leading on to look at a kind of what you call a test to release in a school setting, whereby the children would do a lateral flow test every day, and if it's negative, they can go back into school. Those pilots haven't reported yet, so there's no, change in guidance as yet around rolling that out wider. But it is being looked at, due to the significant impact on loss of education. So that's the situation if you're told that your child's a contact of a case. Obviously, if your child themselves test positive, then they're having to isolate, and anybody that they've been in contact with, or if the parent of a child tests positive, then the rest of the whole household has to isolate as well, and then any close contacts who meet that kind of contact definition would be informed that they have to isolate as well. Sorry, I can't remember if there was anything else you asked within that. Does that cover it, or was there anything else you wanted clarity
no,
on?
I think that covers it, and thank you for that. I think it's just helpful because, as I say, there's in some ways all of that guidance sort of came out months ago, and you kind of assume that people have it to their fingertips, and then actually when you speak to people, you realise that people aren't always clear about exactly what they should do until it actually is them that's facing that situation, I suppose.
Well, one of the things I would say is some of our school leaders are becoming quite expert in this. So, they're very good at, as soon as they get notified that somebody in school has tested positive, they're really on the ball at working out quickly, okay, who's going to meet the definition of a contact. And then the other thing to say as well is, because we have a contact tracing team in York who do all of the follow-up of cases of COVID, that's a number that people can ring. They can contact our contact tracing team. Previously, when it was all done by the national track and trace team, there was no point of contact. If you were told something and then you had questions later, you couldn't get back in touch with them. Whereas now that we have our local team, if anyone's in that situation where they've been told they're a contact, or they've tested positive themselves, but they can't quite remember when their isolation period ends, or they've just got some, nuanced, well, I did this, or, what do I have to do about that? Our team, they can be contacted and will happily answer those questions and talk people through what they need to do.
Thank you. And Councillor Rowley, thank you. You've just noted in the chat that the Prime Minister has now confirmed that the lockdown or the current social distancing rules will stay in place until the 19th of July. So as expected, that's a 4-week extension. I've just got Councillor Norman, who came in at the last minute with a last question, and then I will let you go, Fiona. So Councillor Norman.
Sorry, I was just, it's more of a sort of observation that would be interesting to have comment on off the back of the comments on children in schools. I noticed that the breakdown of cases by age is done by decade, and that did sort of raise an eyebrow in my mind, at least with regards to obviously there's quite a large difference in terms of social setting between someone who's 17 and someone who's 19, and that sort of standing in a sense makes it quite difficult to see how cases are progressing amongst children as opposed to amongst young adults, I suppose.
And I've often thought about that. It's not great because 10 to 19 can mean you're at secondary school, or it might mean you're out working or at university. So whilst we do kind of present it like that, we do also kind of look at the kind of actual age split, and also which schools for those who are kind of still in a school setting. So I think within that age group, I can say that the majority are secondary school age children who are testing positive. The University of York are reporting as well that they've started to see an increase in cases. So that kind of covers that kind of 18, 19 age group as well. But certainly within that, it is more of the secondary school age children. But yeah, I think maybe, you know, next time we update you, we'll maybe look to try and do that a little bit different, so it's a bit clearer and differentiates between those who are in school and then maybe the top of that age band who've left.
I think that would certainly be helpful, just to get a picture of where things are going. I suppose that in the same way that the 10 to 19 age range is quite broad, I imagine there'll also be you know, quite a difference between a 20-year-old and a 29-year-old in terms of, you know, where they may or may not be in life and what they may be up to. So I'm sure that, you know, your team will be looking at those differences across that whole sort of 2 decades, but you know, it might be helpful to see how things break down in perhaps 2 or 3 year age ranges rather than 10-year age ranges, even if just for those couple of age brackets there.
Yeah, I think so. And I think particularly, you know, the vaccination program at the minute is open to the 25 pluses. So, you know, we'll want to see what the difference is as that age group starts to get vaccine before the younger bit of that age bracket.
And there may be something in 25 actually, given that we as a council have that duty of care under certain circumstances to people up to the age of 25. There's obviously a recognition that that's perhaps a you know, a cut-off point in terms of transitions and what have you. Anyway, I'm sure we could discuss that at some length, but thank you very much for your time this evening. That's been really helpful, and obviously you know, I'm sure it's something that we'll all be wanting to keep a very close eye on over the next few days and weeks, depending on which way things pan out. And you know, if I could just pass on thanks again to your team for everything that you're doing for the city so far, and you know, keep on keeping on as it were.
Thank you, Chair.
Thank you. So you're welcome to leave the virtual table now, and I will move us on to agenda item 5, which is the organisational development plan update. So if I could invite Trudy Forster as the head of HR to join us. Hello, Trudy. So just for members, just to remind you, I suppose, really, the organisational development plan was something that this committee was looking at or was beginning to look at pre-COVID, because I think it was a 5-year plan that was due to be rolled out, and we had agreed as a committee that we wanted to have 6 monthly updates to see how the rollout of the plan was going, and I don't think we actually got to our first update of it before we got into lockdown and everything that's happened since, although myself and Councillor Fenton and Trudy did go on a few visits to various places to look at some of the staff wellbeing aspects and look at what partner organisations and other businesses in the city do that we could perhaps learn from. So the reason why we brought this back onto the agenda really was just to get an update on where things are now, and I think it is something that the committee will start to look back again, and I'll certainly be recommending that we take it as a 6 monthly thing going forward, if it is now looking like it's going to be rolled out with a bit more vengeance than it perhaps was previously. So Trudy, if you could just kind of update us on where we are and perhaps speak to the report a little bit, and then I'll invite members to ask any questions.
Great, thank you, Chair. So yes, I think you've captured it correctly there, Councillor Crawshaw. So it is to bring back kind of our update, and you're right, we didn't get back with any first update due to the pandemic. So we had developed the OD plan through significant consultation with all staff across the council. We did that via surveys. We had interactive charts in open spaces. We had focus groups with staff. We had focus groups with key managers and executives. So we really did get a lot of consultation with staff to form what the organisational development plan would look and feel like. And that's what you've got in front of you. And it sets out how we'll build on what we've learned as well to deliver our services across the city. And look to amend any operating practices and models and embrace the more agile and flexible working. So from pre-COVID, we didn't have a strand in there around key working, just to new ways of working. But obviously, as a result of the pandemic and where we found ourselves and many others across the country in terms of those new ways of working, it's how we can really embed that going forward and learn lessons from it. So the paragraph 5 there, just before the diagram, it shows that the OD plan has the 7 key themes. All are equally important elements, and many activities are independent on each other. And you'll see that when if you've read through the kind of annex. And the 8th area around the diagram being an open and effective council. So the OD plan links back to the council plan. It delivers kind of some of the key streams and priorities that are in the council plan and helps support that. A lot of work has been ongoing, so recognising that for the kind of during the pandemic, some of the priorities got deprioritised whilst we were in kind of emergency response. However, you'll know, and this committee's had a number of reports back around the health and well-being of staff was vitally important and still continues to be. So whilst that is a theme in the OD plan, there was lots of work ongoing and continues within that area of focus. And I think picking up from kind of where we were with previous discussions with key stakeholders around the city, I think we've all done something similar in terms of the response to the pandemic about health and well-being. And I think I've mentioned before, there's none of that, there's no silver bullet that'll resolve everything, and cases are very complex sometimes, but we're all offering those kind of similar processes, and we need to again embed that and develop on it further going forward. So the other activity that's been ongoing, there's been a lot of staff engagement as well over this period. So staff engagement events via the online platforms that have been happening every couple of months, led by the Chief Operating Officer, where staff have been public health present, HR present, IT present, and that's really given staff that opportunity to engage and ask the questions. And obviously the concern of staff, and rightly so, is around the pandemic and what that means, what does it mean for them working, and that kind of commitment and support from the organisation. We've done a number of regular surveys through the pandemic as well. I think again we've reported those back to this committee. We have had a huge deployment in that the technology to enable staff to be able to be more flexible and agile and working from home, and really making sure that we support the staff in using that equipment, has it set up right, making sure from a health and safety perspective and a well-being perspective that they're using it correctly, or if they need any help or support with that. We're focusing on moving on around paragraph 10 now, if you're following in the report. So we are focusing around our apprenticeship offer again, both for the development of our internal staff being able to take up an apprenticeship, and for new start apprenticeships. And that's a key as well in supporting the city, if we're able to support apprenticeships across the council. We continue to recognise staff through the monthly staff recognition scheme, and we're reviewing our induction process to make sure that information is available in a timely manner. And we've just run a new induction programme session this morning, which was very well attended. Significant work's ongoing to embrace the more agile ways of working that we've experienced over the pandemic, and staff have completed a survey on that and are really committed to that more agile approach. Engagement events have also happened on that across senior management groups, some key staff focus groups, and obviously the survey, and we've sent a survey to members as well to try and kind of initiate that consultation as well. It's key that the council gets this right in terms of how we work in a more agile way, and that the culture and behavioural changes to support this approach are embedded, along with any changes to any of the physical environments that need to take place. Ensuring therefore that the workplace is fit for purpose. So what a lot of the feedback of the staff has said is around that the main bit that people are missing is that kind of team collaboration, getting together with your team for that kind of more informal discussion around the table with a cup of coffee, discussing kind of priorities and actions. And we need to make sure that the workplace is able to accommodate that in a more agile way. I think experience that you may all have at West offices in trying to get meeting space is sometimes limited, and not necessarily just for confidential space. It's about that, how can teams all get round one table. The development and support are linked with that as well as our hybrid technology. So again, if some people are in a building or working, some people at Hazel Court trying to collaborate with people and discuss people at West offices, or people that are working more agile or across the community, how does that hybrid technology work? And we need to make sure we get that right to enable it to be beneficial. The development support to our managers is key, and I think we've raised this before, that the part of the OD plan is really establishing our managers and foundation kind of programs to train those managers and give them the right skills, and setting the scene of what we expect from managers within York, and how they can support staff, ensure the service is delivered, and all of that comes with that kind of manager role and the leadership role as we get further through the council. Again, some of these new skills need to be embedded. Really, how managers manage in a more agile way is very different to somebody sat in front of you. So it's about how we equip our managers with those skills to be able to do that, and that's recognised as really important, as well as those softer skills around how managers can actively listen to staff, and really if you are in a kind of on a digital platform, how you can ask the right questions and how you can listen to staff and know what's going on. So the next steps then, so we have re-established it, we're getting some momentum behind this now. CMT have got some dedicated time during June to really focus on the OD action plan and to prioritise what's needed. So sitting behind in Annex A, you can see some of kind of the actions and things that we believe sit under the themed areas. What we've got sat in the background is a full action plan, and we just need to kind of prioritise what can be delivered. Obviously, we would love to deliver everything in 12 months, but that's not possible. So we need to be realistic with what can be delivered and what our priorities are. And then that action plan, in a sense, can then be used to measure our performance against delivering the OD plan. And the expectation is that would probably come back here in terms of that, keeping that 6-monthly overview and assurance that is happening. Key to engage with our staff. Obviously, there were key initially in pulling the kind of ideas together, and part of that is re-establishing that and going back out to the staff with that action plan and priorities, and really getting staff involved to change some of that with us, and rather than activities being done to the staff. It's all about kind of that engagement piece and bringing staff along with us. I think that's all I was going to say, Chair, unless there's anything specific you wanted me to cover before questions.
No, that's really helpful. Thanks, Trudy. So members, if you have questions, if you want to just indicate in the Zoom, and I can see Councillor Hook has got a hand up early, so over to you.
Yes, thank you, Chair, and thank you, Trudy, for the report. I was just thinking a lot of that stuff's about interaction between officers and councillors. And at the moment, there are some really good ways that you keep councillors informed of what's happening. For instance, we get the regular monthly planning applications, weekly planning applications, and then the monthly ones about history and what's happened to them. We get regular things about the whole of the city when roads are going to be resurfaced. And that we've been told by Highways that in future they're going to consult with us about what roads and pavements we really think we need to do. But there's other things that happen in our wards, and it would be nice to get a list of all the things that it would be good where people do communicate back to councillors to know the full gamut. Because like I was in a meeting last week and it was a public meeting, and a council officer said they were doing something in my ward, and I thought, oh, and that was a bit embarrassing. So it's always good to have that communication. So there's always things that to work better and smoother. That would be really great as well, if you can include that. But I know that things are improving all the time, but it'd be nice to have a comprehensive list.
Go on, Trudy.
So within this, there is that development around how members and officers work together, and how we can, like you said, things are improving, how we can really build upon that, and making sure, especially when we've got sometimes it's when we've had new staff into some of those positions and not necessarily understanding the kind of dynamics properly and things like that. So I think it is really important, Councillor Hook, that we do include that, and I'll take that issue back in terms of a practical sense of the activities that are happening in wards, and make sure that we can link that through.
Yeah, I think it works well on the ModGov if you're signed up for some things that you know, if it affects your ward, you get a notification. But as Councillor Hook says, you know, there can often be times when works are taking place, perhaps on a citywide basis, but it affects your ward. Or particularly, I know some of the city centre wards, Guildhall in particular, things that perhaps aren't recognised as being ward-based projects, but are happening in the ward, aren't always articulated to the ward councillors. So yeah, anything that can help with that is always beneficial. Councillor Fenton, you had a question.
Thank you, Chair, and thank you, Trudy. Hopefully at some point we can embark again on our sort of visits to other organisations where we started to gather information and examples of best practice, but maybe maybe later in the year. Just a quick question around, I suppose, challenges to the delivery of the plan, and whether, or to what extent, the feedback from staff through the engagement activities have sort of caused you to think again as to whether we've got the key themes right, or have there been any issues emerging from the engagement with staff that that perhaps you hadn't anticipated? You know, has there been feedback around delays in filling vacant posts, for example? I just wondered what kind of feedback you were getting from the staff engagement, and to what extent it had sort of challenged some of the assumptions we may have had about the key themes. Thank you.
Yeah, so in terms of the key themes that are there, they were actually developed from what staff told us in the first place. So it was pretty much a blank piece of paper when we went to the staff and the consultation events around kind of what matters and what needs to be included. So they were born out of, I suppose, the consultation sessions. What was apparent over the last 12 months was we hadn't identified that need to embed different ways of working, which was obviously kind of happening over the 12 months. That staff did feedback in the sessions about how important that was to them. So there was slight changes and tweaks made to that organisational development plan. I suppose what will be the next stage, Councillor Fenton, is from that kind of action plan is really starting with delivering in some of the actions, which will involve staff being involved in that. And obviously that might tweak some of the direction of travel possibly. The different ways of working, we've got a staff group that we go to of about 60-70 people that wanted to be involved on a more regular basis with it. So we're continually consulting and engaging with that staff group.
Thanks, Trudy. Councillor Norman next.
Thank you. Yeah, just sort of on discussions of more agile ways of working, which there's quite a lot of in here. I think obviously a positive thing for many people, and particularly during the pandemic. It just strikes me as well that it would be good to hear about. I know some people work better in different ways, and that's really a crucial part of good sort of human resource management more broadly. So it would be good to hear that, I guess, kind of that agile way of working would also include the ability to work in less agile ways, potentially for council employees if they wanted to do so.
Yeah, so there is a big program going on, just kind of starting off really, moving that forward. I'd like to confirm to you, yes, there is. So whilst the ideas around that more agile working, there is obviously with some individual needs for health and wellbeing reasons, or their home environment is just not fit for purpose to work from home, then there is that ability to work in across the estate. We've got COVID secure buildings that are there that are there to be used. There was a full survey done from staff around that kind of agile working, or how they felt. I mean, I know I've brought staff surveys back here before. Whether that was something that as a committee you may wish to say, I can leave that to you, Councillor Crawshaw.
Thanks, Trudy. I mean, I think we can probably pick up around staff surveys if and when we next come in 6 months' time, if that feels like that's something that the committee's interested in. Sorry, Councillor Norman, I wasn't sure if you were raising a hand for a supplementary there, or whether it was just typing.
Just kind of briefly touching on your going on
Sure.
there, it sounds as if we're going to be talking about this and talking about sort of feedback from officers and employees over a period of time on this. I think it would be good to make sure that whenever we next have some sort of information on here, we also had some feedback from unions on how they're feeling about this as well.
Thanks. I'm sure we can. Trudy?
Yeah, I think just to confirm as well, the trade union, we've got a really good relationship with our trade union representatives, and they're involved on a weekly basis with regards to kind of office readiness, returning staff to the office, and what needs to be that input, as well as kind of regular weekly meetings with myself as well in a more informal way. So they are well briefed, and they've got a lot of good ideas and suggestions that we do take on board across that kind of office readiness group, which is really valuable. So yeah, they are quite key, but I can bring something back at the next the 6 monthly meeting that gives you a bit more assurances around that.
Yeah, I think that would I think that would be helpful, Trudy. I'm not seeing other hands up. I've just got one other question that I wanted to ask, which sort of builds a little bit on some of what Councillor Norman was saying there, but it's a little bit of a sort of a crystal ball gaze in a way. I read quite an interesting piece the other day about, it was a sort of a thought piece, and it was saying that a lot of people have really appreciated the opportunity to work from home over the last year or two, and it's perhaps in some ways accelerated a move to more flexible working that perhaps was already happening at different speeds in different organizations, but society had been moving in some of that way. But what this piece was sort of suggesting was that we need to be careful that we don't go too fast, because actually we're in a slightly abnormal situation at the moment, and what we think we want at the moment, we might find in 6 months or a year's time is not quite what we wanted. And so those positives around, the sort of being able to work 2 or 3 days at home might be really good. But if your colleague that you're also needing to speak to happens to be at home on the other 2 days that you're not in the office, you might start to feel that maybe it's not such a great thing to be working from home as regularly, and all those things about water cooler moments and all of that sort of stuff that we've already sort of touched on. So when we're thinking about how the organization develops over the next sort of year, 2 years, how do we safeguard against almost going too quickly? I know there's conversations about potentially reusing or using West offices in a slightly different way, and potentially having some of the space not necessarily needed by the council if everybody is working from home, perhaps being used by different organizations. But obviously what we don't want to do is find ourselves in 18 months time finding that we've got nowhere for all of the employees who all want to come back into to work because they're all sick of the same 4 walls. How do you regulate that sort of speed by which you should or shouldn't change? Because as I say, agility in the workforce can be a real positive thing, but it may be a little bit, well, like I say, Councillor Dew always used to say, be careful of what you wish for, and much as I don't want to always quote him, it does just worry me a little bit that we might all think that we want to work one way, and in 2 years' time we might actually think, maybe that wasn't.
Yeah, so as a project team, a program team, we've identified that as well, that actually we don't want to our approach to it is going to be kind of pilot and testing it. So as we get people back to try and actively engage with the new ways of working, if there's some kind of new changes to the environment, but nothing kind of set in stone, if that makes sense. So then we get the feedback. So it's kind of the iterative process of getting the feedback and going, right, actually we haven't got this right, what do we need to change now? I suppose I haven't got kind of a timeline around this, around that kind of how many months and years do you do that for before you go, actually, this is the best fit for where we are now? I suppose it's that piece, isn't it, that the world's always changing, and I suppose it's how we can be part of that agile working is being responsive to what's going on in the environment and what's happening, so that we've got the ability to respond. I mean, kind of look at what 14 months ago, 15 months ago, you'd never have thought kind of overnight we'd have all kind of had the ability to work from home. So I think it's acknowledging that kind of ability to adapt to feedback and changes and what's happening. And it's the same with people's kind of life circumstances, isn't it? While some people might be quite happy currently, it's working at home, personal circumstances might change, and their environment then becomes not fit for somebody to work at home, for example. So we need to have that ability, like you say, within the council estate to accommodate, so we haven't got no space left and therefore you can't come back in. That's not where we want to be. So I suppose there's not a specific answer to that, but I think we're aware of that as a project team, that it can't be right, we're changing everything from September and that's it, you've got this area, that area, and that's it, and we're not changing it ever. We have said it has to be that kind of test it and see, get feedback and go, we've not got this right, let's move, let's try the next thing.
Thanks. That's reassuring, because as I say, I think I'd be worried if we were making big changes sort of right now that might affect the next 4 or 5 years when we're not quite sure where we are. And I think you only need to look at the way that we kind of dashed towards open plan office space and then found that actually that really doesn't work for a lot of people, and has all sorts of impacts. So I'm sure that you'll be keeping an eye on things like staff absence and those sorts of things, if any of the changes to the way of working are having knock-on impacts in those areas as well. Councillor Hook, you had your hand up, and then I think unless anybody else has any further questions, I'll draw this section to a close. Councillor Hook.
Thank you. Mine's only just a quick comment, but I've always felt that at the start of the pandemic, working from home would have worked because everyone knew their jobs and they were established in their jobs. But when you've got a lot more recruitment of new people and they don't know what they're doing, you need someone to hold their hands, really, don't you, when they start? And I know some people have probably come in from scratch and managed to cope, but I would think as the workforce changes and gradually you get more and more new people, that will make things a lot harder. So, but that's just an observation.
Okay, thank you very much. I'm not seeing any further hands going up. So I think if we can ask then if we get something back in 6 months' time on this. And I think we perhaps, when we get a bit closer to publication date, we perhaps you and I have a conversation with Councillor Fenton as well about what exactly we'd like to see in the next version of this, and I think perhaps some feedback from unions and some staff feedback on any changes that have perhaps come in is probably where we'll be looking. But obviously with the world as it is at the moment, who knows where we'll be in 2 months' time, let alone 6 months' time. But anyway, thanks ever so much for your time this evening, Trudy, and you're welcome to leave the virtual table now. So normally I would call an adjournment at halfway stage, but I think given where we are on the agenda and given that we've just got one item left, I will just move us straight on. If anybody is finding that looking at a screen is you've been looking at a screen all day, I'm happy for you to just switch your video off for 5 minutes whilst we move on through, and I can still see your hands if you've got any questions that you want to raise. But if I take us straight on into agenda item 6, which is again organisational development programme update, but this is more looking at the external focus of what the organisation's doing. And we've been joined by Pauline Stutchfield, who is the Director of Customer and Communities. I think I've got your title correct, is that right? I know you've sort of changed roles recently, so congratulations on the new role, and hopefully I introduced you correctly. If you could just talk us through, talk to your report, and then I'll invite members for any questions.
Thank you, Chair. Yes, and this report very much focuses on those services that have come together in customer and community services, talking about what happened during COVID to those services and what we're planning for the next steps. The first part of the report talks about customer services within the sort of the corporate set of functions, and the second part around the communities-based working, focusing on the hubs, which is going to be the core model for community service delivery in the future. And I shouldn't really talk about delivery because this is really about co-production and building community capacity. I would say that not included in this report are a range of other customer facing services. You would have had a 50-page report if I'd have included services such as planning, housing options, blue badge, probation, social services, and York Learning. So maybe they're subjects for another day. So customer services has, as well as continuing to provide services across its existing portfolio, it has provided the triage and signposting for the COVID phone line and email boxes, and obviously last year we were very busy in dealing with calls and emails that then went on to be delivered by the virtual hubs that I'll talk about a little bit later on. There are very few calls now or emails to those inboxes, and the intention is to close these at the end of step 4, which is now moved on by a month, but they can be reopened at any time, and it has been a successful model, and it is one that we can call on in the future. Paragraph 3 talks about how we operated during the COVID period, and what we mean by the customer centre are those services that operate from the face-to-face centre on the ground floor at West offices and the phone centre on the first floor of West offices. And the customer centre moved very quickly to home working. And the way they do that is they operate from the PCs that are based in the West offices, but from an extension from their home, which is very clever technology. But it has worked very well, and the majority of staff are still working from home now, taking the calls for the customer centre. The physical customer centre at West offices are reopened on the 17th of April. They are operating on appointment only, but it had moved to operating on appointment only prior to COVID. This is not something new, as we transitioned many services online. So it allows us to focus the face-to-face interactions on those customers with the most complex and immediate needs. And so you won't be surprised to hear that the footfall has remained low. And prior to lockdown, 50% of footfall was for parking permits, which we've fully transitioned online to a click and post service, and that will develop further as we bring in a new parking system later this year. So we have seen that reduction in the customer centre. More broadly, many members of our revenues and benefits staff have been involved in delivering COVID grant schemes, whether they're business grants, but also the welfare benefits grants that we've had to support residents in difficulty during the period, whether this be winter support grants, test and trace, or York Financial Assistance Scheme. And you can see in paragraph 4 some of that support being delivered. The challenge for us more recently is that we're still delivering those grants, but we're also delivering business as usual in terms of things like recovery as court processes have started again. But we do see these services as critical as identifying those customers who do need support as they face financial difficulty coming through COVID. It sometimes gives us the early indicators of where that support is needed. If I just jump then to some of those other services provided by customer services at the front face, if moving to paragraphs 9, 10 and 11, York Crematorium has continued to operate through the pandemic, but as you're aware, we are still limited due to social distancing on the number of people, family members we can allow into funerals, sadly. And that's the reason, picking up Councillor Rowley's point earlier around charges, that we do have reduced charges at the moment for families, and we have free recordings that they can share with other family members who can't make the funerals. Interestingly, the drop in funerals is 48% on this time May last year, which shows you sort of the level of funerals that we were dealing with during the height of the COVID pandemic. The Register Office has continued to operate all the way through the pandemic, but most of that was virtually during the pandemic. It's during the first lockdown, and with more face-to-face appointments being offered during the second and the third lockdown. Since the 29th of March, the happy news is that we've conducted 173 marriages and 680 are booked at the end of year. So we're expecting a really bumper year in terms of marriages. And the Mansion House reopened on the 19th of May, and we allowed residents and key workers free access until to the 31st of May, which has allowed people to reconnect with the house. I'm going to go backwards to paragraph 7 and 8, because I think they link nicely into the hubs section of the report in terms of the restructure, bringing together of the services to improve the customer journey and the closer interaction of customer and community services across the piece. So in terms of customer services, we already have staff working at York Hospital, the Sure Start Centre, and working in the community, including those that work alongside our adult social care customers. And we have peripatetic benefits workers, for example, that work directly with customers. And it allows us to provide more direct support to those in need, working with local area coordinators and hubs that have now moved into the directorate. We also have what we call a quarter protection service to 259 residents, managing estates of around £10 million. They have often don't have the capacity to make decisions for themselves and have no family or family members to do that on their behalf. And we work to support them. That work has been done by phone and virtually over the COVID period, but that face-to-face service will return in the future. So moving on to hubs, you will be aware that the Communities and Equalities team continue to operate a network of virtual hubs as described in paragraph 12. And more recently, they've been supporting the clinically extremely vulnerable and those who were referred for support in earlier lockdowns. And on Friday at Foxwood, I met a lady who received a phone call in week 1 of the original lockdown as a shielded resident. And she described to me how connected she's felt every week ever since the COVID pandemic started, and how much closer she feels as part of the community now. And she physically now attends Foxwood community sessions and the food bank operating there. So some really successful work going on there that will stand as well for the future. Shielding came to an end on the 31st of March, but authorities continue to be required to make provision to support those who still have to self-isolate. So we are planning to roll out back out the physical hubs at the earliest possible time at step 4 and deliver on the council's priorities to have a hub in each ward. And unfortunately, because we only have 5 virtual hubs operating, it is at a time where there are clear issues around increase in mental health issues caused by isolation, and as my specialist subject, issues around financial inclusion are starting to grow and become significant for residents across the city. And we are seeing more and more new people enter into the welfare system who require that support. So it is critical that we have a transitional approach to make sure that we are working hard to make sure that we are building on our vision around community hubs. So community hubs are starting to work closer with ward teams again to link in community groups with those that have been formed in during COVID with the aim of establishing a network of trusted community groups. And where there are gaps in provision, we will be working with ward members to use ward budgets to fill in any identified gaps. Hub managers are working to identify those who may benefit from engaging with a local hub longer term, not just short term for support, and making sure that we've got regular contact with them through wellbeing calls and doorstep chats. The Hub's commissioning budget will be used to commission services as necessary through the voluntary and community sector. So we'll work closely with CVS on those. And we're establishing better referral processes, particularly on council tax or rent arrears, to ensure that the hubs are used as a place to identify those triggers and operate as a front door for residents in crisis with a direct link through to the Revenues and Benefits Service. Working on successful financial inclusion projects of funding citizens' advice to work within wards. We want to build on that, and I know that ward members have in certain areas have certainly funded that advice in the past, and we want to re-establish and strengthen that approach. Also, Live Well York is surveying partners and citizens in relation to looking at isolation within York, so that we can ensure that cohesive provision is made across the city. We started to map community assets on Live Well York prior to COVID, and we'll be updating that information for our residents. So once we have reopened all of the physical hubs and we've built on the numbers across the city, we'll be rebuilding that Good Place peer network, and we'll have a York Community Hubs accreditation scheme so that we make sure we're bringing them on all to a similar standard. I haven't mentioned Citizens Advice York with the operating West offices. Just to mention at this time, they are looking at using an appointment-based system for short and potentially medium term for customers that previously wanted to come to West offices for advice. They do see some form of drop-in operating from West offices in the future, but they are wanting to work closely with us on our hub vision to deliver services closer to residents rather than focus only on West offices. And then finally in the report, at the end of the report, you've got some of those leisure and cultural services opening plans. Most of them are open now, with one or two, such as the Yorkshire Museum, having a later opening date. So happy to take any questions.
Thanks a lot for that, Pauline. That was really helpful. I'm going to bring Councillor Rowley straight in because I know that he's got to go in a couple of minutes' time. He did mention to me earlier on that he needs to leave the meeting early. So Councillor Rowley, get your questions in now and then you can leave.
Thank you, Chair. I do have another parish council meeting to attend, so I do apologise. Pauline, thank you so much for that really extensive report, and just well done to all the agencies under your command, as it were, that are working so sterlingly. Just a question that I have, which kind of relates to my profession, as is always the case. The registry office. My understanding is that at the moment the majority of registrations of deaths are done via a telephone appointment, and certainly I can say that the feedback that I've received from clients is very positive, that they no longer have to go into the registry office. They don't no longer have to pick up the medical certificate for cause of death from the doctors. And I'm just wondering, once we are out of lockdown, are there any plans for us to continue that, or are we going to have to revert back to what we were doing before? Because I think if we do have to revert back, I think it's a backward step.
I think that's a really important point of feedback that we'll give to the General Registrar's Office and the Passport Office. Clearly, the way that we work in registration services is dictated by them, not by us, unfortunately. But we'll certainly give that feedback, and I'm pretty sure that the staff will agree with you on that point. But we will give that feedback back.
Thanks, Pauline. And that's Councillor Rowley now, I think, left the meeting. I think Councillor Hook is also saying that she has a parish council meeting. This is an informal committee meeting this evening, so I am comfortable if you do have another commitment that you need to get to, though obviously I'd sooner that we didn't drop down to no members left, so I don't want to see you all sort of switching off at this moment. But if you did need to get to a parish meeting, that is fine. Councillor Fenton, I see you had a question.
Thank you, Chair. And I don't live in a parished area, so I won't be going off to any parish council meetings. Thank you, Pauline, for that update. I just wondered, over the course of the pandemic, you mentioned the increasing shift to online channels. Have we seen an increase in the number of residents signing up for the My Account option? And just if you could say a little bit more about what the hopes and aspirations are for using that vehicle for increasing the choice for residents in terms of how they interact with the council. And just another quick question on customer services. Obviously, it's good to hear that that sort of triaging of calls and emails has sort of continued, and the workforce has adapted to working from home. But I'm conscious that in many cases, the complaint or the query or the comment is received by that team and then farmed out to some of the teams out in the services. And how have they coped in terms of, whilst we may have responded to a query and allocated it appropriately, how have we been performing in terms of substantive responses being provided to residents, where your team is captures the query but can't necessarily answer it? Thank you.
Okay, thank you. Just in terms of your first question around My Account, sadly, My Account's not turned out to be something that we'd hoped. If you recall, the vision around My Account was to have as many council services available to residents of a online nature, to be able to log into one portal and get all the information that they need. The difficulties around that are several. One is that different services require different security levels. So being able to see some information such as your council tax account might be very different to seeing something around your child's social care arrangements, for example, and having different levels of security. The other issue is having the number of services in there that people can access, and we're still limited to the services we had on our legacy systems before. So they are, in summary, the place-based services. So you can access reports such as reporting street lighting defects, reporting potholes, reporting weeds, all of those kinds of things. But we haven't got all of those other services on or integrated. The third element of that is when we've come to develop new services, and we've got this on the new parking system, is that the log-on arrangements and the log-in arrangements are very complex and very costly to integrate to the Oracle My Account system. So whereas many years ago we thought we could do this very easily and very cheaply, the ICT sector have made it very expensive to integrate systems. And so in the short term, we can see that actually we'll have several logons from the council websites. And that's something that's developed in other local authorities as well. They've actually not seen the benefit of a single sign-on. They've actually said, if you want to use a parking system, if you want to use a revenues and benefits system, actually go straight into that system, use your usual logon and get access to the services you need. Actually, multifunctional and multi-service access is not what people are looking for anymore. I think this is something that Scrutiny could help us with going forward, about how we relook at that vision and how residents might view access to online services going forward for us in a way that's easy for them. Long answer, sorry.
No, thank you, that's helpful. And Councillor Fenton was a supplementary there.
Thank you, Chair. And yeah, well, personally, I'd be something I'd be interested in looking at, and I'm sure we can, as a scrutiny committee, sort of feed it into the into the pot when we discuss future work. Just the second part of my question around pressure on service area teams in terms of handling the queries that your sort of front-facing team would triage, and how that has performed over the last year.
I'm not aware really of any change. Obviously, with inquiries reduced in certain services as we stopped to during lockdown to deliver some front-facing services. So the pressure reduced on the service and allowed us to concentrate on the COVID line and the COVID emails. I don't know if Janie's got anything that she's got around complaints, but I think it was business as usual, to be perfectly honest. I can't think of anything significant.
So it was more or less business as usual. There was a slight dip because we did concentrate on the COVID related issues and offered support to the frontline services such as children's services and adult social care. But as far as I'm aware from the customer complaints team, we've tried to maintain a very high level of response, and it has been business as usual for quite a long time.
Thank you. I certainly think that the accessibility to online services is something that this committee certainly I'd be interested in taking that forward and having a look. So I think we'll have to think about what the best way in which we bring that forward is, but that certainly sounds like something that we could get our teeth into. Councillor Norman, I've got your hand showing next.
Cheers, thank you, and thank you, Pauline, for the report. I'm sure I'm not the only member who's struggled previously with having residents who could quite clearly benefit from local area coordinator support, but geographically don't fall into those key areas. I note that paragraph 7 is talking about sort of the restructure and the way that we talk about things in a more holistic and joined up way. Is that a sort of indication that we're going to see more communities in the city being able to access that level of local area coordinated support, or is that a misreading of that paragraph?
No, you're right. We're hoping to recruit more local area coordinators. The challenge for us is the long-term funding of the service, as our local area coordination service in the majority is funded by the Better Care Fund. So that's the challenge going forward, is identifying that permanent funding base. But we are recruiting more, yes.
So it's a sort of aspiration for it to extend. And does that, does that mean that we're moving away from the model of geographical bounds to those areas, or are we still going to be talking about local area coordinator support being based on geographic location?
I can't answer that question at the current time, but I can get that answer for you.
That'd be really helpful if you could, Pauline, because I know from my own experience that Micklegate Ward doesn't have a local area coordinator, but actually has a higher level of demand at times than Guildhall, which does. And so we sometimes end up borrowing bits of local area coordinator, and they're really effective when we get access to them. But it's infuriating when we don't. I'm just going to jump ahead of Councillor Musson. I can see you got your hand up, but just because you mentioned a little bit about the funding there, and that some of the answer to that question around local area coordinators might be partly sort of dictated to by funding going forward. And you mentioned it says it in the report, and you did sort of highlight the model of community hubs, sort of building on existing support that there is in the community, but also looking to ward teams to fill gaps in provision where it's identified. And my concern with that is that, as far as I'm aware, the allocation of ward funding is not done on a need basis. It's done either per capita or per councillor. And so it seems to me that the flaw in that model of funding is that the areas where the gaps of the provision will be, your ward team might identify the need, but they may not actually have the money to be able to fill that gap in provision. And just to give you a really concrete example of that, we in Micklegate Ward had an application from Changing Lives for some substance misuse outreach work, which we were looking to tie in with the community hub and things that we have in the ward. But actually it was a citywide request, because Changing Lives, is open to absolutely everybody. And we did try to get it centrally funded. And unfortunately what happened was we were told, well, it's in your ward. They're based at Micklegate Bar, so you have to fund it if you want it to happen. And so as a ward, we thought, well, it would be wrong for it not to happen. But then as a result of that, we've had to make some very difficult decisions about some of the other things that we would like to fund, like citizens advice that you've mentioned, and one or two other things. And I'm just a bit worried that the model overall is not a bad one, and the idea of bringing in different groups together is great. But if the funding is year on year, because that's the other problem with ward funding, is we can only give 1 year's worth of funding because we don't always know what our allocation will be next year. It makes it very difficult to build up services. And as I say, wards where there's particularly high levels of need in particular areas may end up not being able to deliver some of the other things that other wards where there's a lower demand for, say, substance misuse services, or for financial assistance schemes or what have you. So what can you do to sort of allay those fears, I suppose, really, around the way that the funding model is going to work going forward, such that we get the services into the parts of the city where they're needed most, I suppose?
I think that's a good question, and I think it might be worth us coming back a future meeting to have those discussions, to look at those funding allocations and sources and plans, and Charlie can come and talk about some of that. Is it worth a further discussion? So we concentrate on that for feedback to executive.
I mean, if you're not in a position to be able to give us an answer on that, it's certainly something that we could look at revisiting. I'm conscious that it's a question that's been posed several times by several people, and I was sort of surprised to see in this report the explicit line about saying that ward budgets will fill identified gaps, because I think that's been our worry for quite some time. And now it's sort of there in black and white that that's what's being asked. Councillor Fenton, you had your hand up as, I think, possibly supplementary on this, and I'll happily bring you in if you've got something that you think is relating to this that would help us move on from it.
Just to add, the Children Education and Communities Scrutiny and Policy Committee has just embarked on a scrutiny review on community hubs delivery, and one thread of that is funding. So I think some of the issues we're talking about here could quite easily be picked up as part of that. Where that's myself, Councillor Webb, and Councillor Fitzpatrick, and I know Charlie Croft has been liaising with us about that. So I think that can quite usefully feed into that piece of work.
Thanks, that is helpful. I think certainly from my perspective, and I don't know if other committee members have a view on this, but from my perspective, I think it would be really helpful if we could get some clarity around exactly how the funding will work. I think Pauline, you mentioned was it the Better Care funding for the local area coordinators, and if there's a bit of well, not lack of clarity, that's the wrong word, but a bit of maybe insecurity about how that funding will be going forward. I think it would be helpful if we knew something more about that. And if you could particularly, Councillor Fenton, if we could pick up that point around ward budgets being used to fill identified gaps. Because I think, as I say, my concern is that there will be gaps in some wards that won't be reflected in other wards. And if the funding isn't commensurate with the need, then we'll identify the gaps but not necessarily be able to fill them because we won't have the funding available in the wards where it's needed. Thank you. Councillor Musson then.
Thanks, Chair. I do actually have several questions about community hubs, and apologies I had to step away for a minute because there wasn't a break. So if I've repeated anyone, I do apologise, but I'll just start with a few, if that's all right. And then if it isn't picked up, I do have some more, but conscious other people might also want to speak. So in the report, it does actually say a community hub in every ward. So are we genuinely talking about 21 different locations, or are we talking about the 5 or more, maybe slightly more locations, and we're just signposting to them? Obviously, I know that, for example, Tanghall Community Centre is right on the border between Hull Road and Hewer. So I would be really interested if we're genuinely talking about 21 locations, or obviously a little bit less than that. I had the same concern about the ward funding point, actually, a few other logistic questions as well. So it's good that that's been picked up. Another question I have is sort of what's the timescale for the rollout on this? And then I'll just leave it with a third one, which is, are any of the staff that work at the community hubs currently or might work from in the future, any that are affected by the risk of redundancy that came to light just recently?
Shall I start with that one? I'm assuming you're talking about the 20 that was quoted in the statutory statement around redundancy. There are several services being brought together under Charlie Croft and the early help area that includes staff from the ward teams, equality team, the local area coordinators, sports development, some elements of the local area teams such as the Live Well York and Family Information Service. They're all being brought together. There are no redundancies at a lower level of the service. There may be a redundancy at a higher level of the service as we bring those structures together. But we're not looking at significant numbers, and we're hoping to redeploy most staff. But it is a brand new service, so you would expect different roles and different jobs. Okay. In terms of the community hubs, yes, there will be a focus for community hub working within each ward, but it will mean different things to different wards. So in some areas that might be community centre based provision. In others it might revolve around a different service provision. I'm not the expert on this. I'm only hesitant because I've only just moved into role, and Charlie really is the expert around this, and he's not here tonight. But yes, the ambition is to roll those out, and there'll be a real focus on that over the next 12 to 24 months. Because not least because of the need that is across the city arising from COVID, and the need to provide early help and support for those who are new to particularly financial difficulty, for example, and those affected by isolation. Is that okay? Have I answered? Oh, that's good.
Did you get all 3 points in there yet? Great. I'm just looking for anybody else with a hand up, and I'm not seeing anybody else. Councillor Musson, I think you said you had a few questions. So with the absence of anybody else, I'm happy for you to ask a couple more. I am conscious that Councillor Pearson needs to leave the building by 7:30, otherwise he sets all the alarms off. So what I will want to do is make sure that we don't inadvertently cause some sort of an issue down on Skeldergate. I presume it is that you are, but Councillor Musson, over to you. But I think if we can try to start to move to wrap things up over the next 5 minutes, that'd be great.
Thanks. So, fourth question: what's the relationship between the community hubs and children's centres? And if we are developing the community hubs and they might take on more of that health and social care aspect and other stuff, will the children's centres continue to exist in the way that they are now? Would they reduce in any sense? And then another question, apologies, is sort of linked to the Better Care funding, because I recall we were told about a pot of money which was available to apply for communities, and it ended up being actually not eligible for certain things because the money that it had come from was restricted to food poverty. So is there a risk that is there any restriction around the Better Care funding? And if we are reliant on that, does that mean that we might be restricted in what we can do, and that will kind of lead into more relying on the ward budgets, which might, have logistical impacts in itself?
Children's centres are another service area moving into my services, with the very reason that you talked about. So we fundamentally review their purpose and their vision, and this might be something again that Scrutiny may be interested in, and we are looking at in the same way we did with youth premises, looking at the best way that they can be used in the community. So, for example, some children's centres are the schools are wanting to take control of children's centres, and in other areas we want to make them sustainable as a community facility going forward. So they will be fundamentally reviewed from bottom up. What is their purpose, what are they doing, what are they costing, what are the resources that are needed to take care of them, what functions can they provide. So yes, it is feasible that they could become part of the hub strategy as well, if they can serve that purpose, depending on what they're going to be used for. So it's very, very early. They've not even come across yet. We haven't even started that work yet. But yes, they can be part of that strategy. better care funding, again, the experts in this are sat within the People Directorate. The new Director of Prevention and Commissioning will be managing the Better Care Fund and monitoring it going forward. The Assistant Director of Commissioning currently manages that funding on behalf of the CCG and the council, and delivers all the projects in there. And I'm not close enough to that to talk to you about how that money is spent and allocated. All I know is that one of its many projects it is to support and fund the local area coordination and an early help team to avoid people entering, or to help people early in the system to avoid them going too far into the system and then becoming having to be supported at a more costly level later, if we can avoid them going further and supporting them as soon as an issue has become has been brought to our attention by a local area coordinator. They do exactly that. That they spot the issues early, they look to address those issues early and avoid an adult or a child moving into the system, working closely with the local area teams. I'm not describing that very well. A bit tired now, but yes. So I think again the adult social care the CEC scrutiny are probably closer to the Better Care Fund. Councillor Fenton, I don't know if you can respond any on that.
I don't think we are, to be honest. It's yet it's not an area we have yet looked at in depth, but I'm sure as part of our work on community hub delivery. So it's a very useful pointer. So thank you, thank you for that. But I can't really say any more.
It's incredibly complex, the Better Care Fund.
I think I think you covered all of the points that Councillor Musson had raised there. I was just trying to sort of tick them off as I went through, but I'm sure Councillor Musson will tell me if I've missed anything. No, great, that's it. No, that's been really helpful. So I think Councillor Fenton, perhaps when you and I are looking at the work plans for the various committees, one of the things we might just look at is whether children's centres, that review of the purpose and the vision is something that's on the CEC work plan, and if not, then we might suggest to the chair there that that's something to look at going forward. And likewise, if you can add the Better Care Fund to all of the other things that you're looking at around the funding of community hubs, I think that would be a sensible way of managing that. I'm not seeing any further questions, any further hands raised on this particular section, and I'm conscious of the time. So I think I will just bring that to a close and say thank you very much, Pauline, for that. I appreciate that you're sort of early days in the role, and there's an awful lot of stuff within that. Again, I think it might be the sort of thing where actually it would be helpful to have you back in sort of 6 months' time as things are sort of moving forward and developing, and you're perhaps in that role and seeing how things are all working together with each other. So what we may look to do, I don't want to promise everybody, but you know, if we look to bring this same sort of pairing of the sort of inwards and outwards organisational development to a future meeting in 6 months or so, I think that would be very constructive. So otherwise, I'll just say thank you, Pauline, for your time. You're free to leave the virtual table, as it were. See you later on. And then I'll just note Councillor Pearson has had to leave because he didn't want to set off all of the alarms, but we are very nearly at the end of today's meeting. Agenda item 7 is the work plan. Just to update committee members, I've asked all of the chairs and vice chairs of the other scrutiny committees, they're all meeting effectively on a quarterly basis across the next municipal year, with obviously the commission slots that we've variously used in a sort of ad hoc way. So I've asked them to kind of use June to look at what a skeleton work plan would look like for their regular slots, and to flag up any particular areas that they think might be useful for commission slots, both in terms of areas of interest and things where they can add value, but also in terms of, as things are coming onto the forward plan, if there's ways of adding value to anything that's being discussed. So they've been meeting across this month as committees and with the executive members and the corporate directors to look to bring that together. I then was conscious that actually we haven't done a similar piece of work with this committee. So what I would welcome from all of you is any input, not right now necessarily, but if you wanted to send me over the course of the next week or two emails with any ideas of areas that you think that this committee ought to be looking at over the course of the next municipal year, and then myself and Councillor Fenton can have a bit of a sift through and see how that relates to the wider scrutiny work plan, with a view to starting to have a more longer term sort of work plan of the committees. Necessarily over the last year we've had to pick up a lot of stuff quite last minute, but I think that we are all keen to move back to a more structured, more longer term work plan, where we know where things are, if not for the entire agenda, at least for 2/3 or 3/4 in 6 months time or 9 months time or what have you. So that was the update on that, and unless anybody has any further questions, I have no urgent business, and so I can't see anybody chomping at a bit, and so at 31 minutes past 7 I've just broken my 2-hour rule, but I will draw the meeting to a close. So thanks to all of you for attending, and all the technical staff and the democracy officer in the background, and good evening. We'll see you next month.